Hello, my name is Deborah Calendar, and I'm going to talk a little bit about eating and drinking as it pertains to people living with dementia. People living with dementia can experience challenges with eating or drinking for many reasons. It's important to say here that dementia can have varying degrees of severity. So a person may have a mild, moderate, or severe presentation of dementia, or they might have cognitive impairment. So depending on the stage and the severity of the dementia they're having, they might forget to eat or drink, have difficulty with food preparation, or difficulty recognizing some food items, and they may also have changes in appetite and how things taste to them. They may not realize that they're hungry. They might have difficulty swallowing. They may have environmental distractions. They may be focused on doing something or another activity, and they also may experience changes in food preference. It's important to note here that if they are struggling with difficulty swallowing, a speech therapist can be very, very instrumental in remediating that difficulty. Difficulty swallowing can lead to pneumonias and what we call aspiration, which is where contents that are meant to end up in the stomach end up in the lungs instead and cause complications. So really seek help through your GP and a referral to a speech therapist if you're struggling with swallowing. When a person with living with dementia presents with these challenges, the first things we want to rule out are that they have mouth pain or dental problems, teeth pain, that they are constipated because we know that constipation can cause them to feel full. We want to be sure that whether or not they have an infection or any other physical illness, and this includes an experience of pain. And we also want to rule out depression. It's important to say here that depression is not a temporary episode of sadness. Depression in itself is an illness, and it can be identified and medicated or solved with the help of a good general practitioner. It's important to offer someone living with dementia who is having challenges with eating choices in terms of what it is they can consume in terms of food and drink. It's important to ask them what it is they would want to consume that day and offer a choice of at least two items. You might want to offer a small snack or a taste of the items you're trying to help them make a decision between, as this can help them to realize that they're hungry, and it can also help them to make a decision as to what they want to consume. You can also try these ideas. Offer something that is easy for the person to eat, something that they like to eat and might be able to manage to eat on their own if possible. Consider offering small regular meals, maybe 5 smaller meals for the day instead of the 3 large ones that we might traditionally be consuming that they might find hard to finish. Consider being flexible about the timing of meals. They may not feel or be able to consume food at strict times, and also try not to offer food when the person is tired or distressed in some way. So try to have a little bit of give and take in terms of offering the food and also not having the expectation that they must eat at a strict meal time in quite the same way as perhaps they did when they were well. We want to minimize noise and create a calm environment, turn off TVs and radios, put up any activities they might have been doing to minimize distraction and provide a relaxing environment. The environment should also be well lit because we also know that many people living with dementia are prone to hallucinations that are created by shadows. Try not to rush. If it's the most important thing, do not rush meal times and do not try to rush the person living with dementia who is eating. It begins to create an association between unpleasantness, stress, and a feeling of being hurried and meals, which we definitely don't want in someone who already has challenges. So to minimize frustration to yourself and to the person living with dementia, accept that people living with dementia are going to take a much longer time to consume meals than we perhaps will if we are not living with dementia. We also want to perhaps describe the food so that it helps them to identify it, as we discussed earlier, and try to use plain plates and crockery, as the same threat of hallucination can occur with decorated plates. With dementia, we can see the person experiencing weight gain or more commonly weight loss. It's important to remember that pureed food is less nutritious even if it is more convenient. A common tip that is offered is that if you can add skim milk to perhaps soups or offer them milkshakes during the day or ice cream shakes, these are high, and add skim milk to fortify it or give them a fortified drink with skim milk in addition. These are ways to boost nutrition in ways that they might enjoy. It's also important to remember that people living with dementia, they really do need a high amount of nutrients. And all older people, not just people living with dementia, really benefit from a higher calorie diet, a higher nutrient diet. You might want to discuss this with a dietitian or a nutritionist so that they can make recommendations about this. If the person is overeating, which is also fairly common in people living with dementia, you might want to consider serving exact portions and also placing food out of the line of their sight. Talking a bit about food storage, try putting food in clear containers so that they can identify and clearly see what is in it. Try to cut foods into small portions so that it's easy to handle and for them to consume independently if possible. You will have to check for and throw out expired food from their cupboards and fridge. And if it's possible and affordable, consider using frozen ready meals sometimes and taping clear instructions for cooking to the container that the meal is in. Thanks for listening. If you want to connect with me, you can WhatsApp me at 829-8200. My Instagram is at Calendar Deborah. My email is homecare4ja@gmail.com. There's a lot more information about eating and drinking and the challenges faced by persons living with dementia. I hope this has helped. Bye for now.